It is a sound that is synonymous with emergency, and every time such a sound is heard, then things come to a standstill and pave way to ambulances. For more than 40 days now, ever since the first COVID-19 case was reported in the country, Emergency Medical Plus has been working hand in hand with the Ministry of Health in evacuating of patients or suspected cases of COVID-19. According to Amran Jumanne, the logistics officer, a number of ambulances have been designated to COVID-19 response.
The pandemic is very contagious and is something that needs proper attention in terms of disinfection of the ambulances after every call. Therefore, we do not want to mix the ambulances that are responding to COVID versus our normal emergency services. Therefore, that is why we had to designate certain units for the special operation for the COVID-19 response.
Morning briefs are part and parcel of the routine work for the team. This helps them underscore the milestones made as well as dispatching the team. Today's team lead paramedic is Samuel Kagumo, who is in charge of the team stationed at the Ministry of Health. COVID-19 response is a new phenomenon in the medical field. As such, E-Plus takes maximum precautions in line with the provided guidelines to support the government initiative to mitigate the COVID-19 pandemic while saving lives. Once a dispatch call comes in, the team that is meant to respond first has to don their PPEs. This is the procedure that is carefully followed to ensure the paramedics don't get into contact with the patient.
The process of donning is the process of wearing your correct PPEs, and so that you don't get exposed or you risk infection. The first step that you need to do is ensure that you have all your PPEs and the correct ones. And then now from there, you have to fully and properly sanitize your hands. And then you wear your first set of gloves. Then from there, you have to wear your shoe covers. From your shoe covers, you now wear your gown. After you've worn your gown, ensuring that your gown doesn't don't get contaminated. And then now from there, you wear your mask. Basically for us, you're using the N95. And then now from there, you wear your goggles, and then you wear your hood. So once you've worn all that, your colleague should actually ensure that you're fully covered to ensure that you don't risk any infection. Yes, there's no openings and you cannot get infected, either maybe by maybe if the patient coughs or sneezes, you don't get infected.
Once this is done, the two leave for the response. It is equally important to note that the paramedics ensure they will have little or no physical contact with the patient, even as they help them into the ambulance.
The first thing is to introduce yourself. And after you've introduced yourself, you give the patient a surgical mask. You sanitize the patient, and then you give the patient a surgical mask. Once you've done that, you direct the patient to the ambulance. Once you've directed the patient to the ambulance, in our ambulances, we are using disposable sheets. So you now direct your patient where the patient will sit in the ambulance. And then for the paramedic, you come in front and then you evacuate the patient to hospital.
One of the major challenges of the paramedics at work during response is some patients prefer not disclosing their location for fear of stigmatization from neighbors. Hence, they meet halfway with paramedics in locations where their identity is unknown.
You can be dispatched to go and pick a patient from a certain place, but now the patients will not be comfortable you coming to their place, because once people see the ambulance and see us fully done, they get scared.
Once a patient has been successfully handed over to the hospital or referral facility, the ambulance is decontaminated and waits for 30 minutes before it is thoroughly cleaned. At this point, the operator alongside the paramedic head to the E-Plus headquarters where they doff as well as ensure the ambulance is thoroughly cleaned.
We coordinate, tunangoja 30 minutes kwa sababu dawa ingie kwa kila kona ya gari. For 30 minutes, tutanga 30 minutes alafu tupeleke car wash, clean thara because hatuwezi tumia tena kwa sababu iko na germs ndani. Tukitumia hivyo inaweza ambukisha mwingine, but mwingine hakuwa confirmed case, maybe alikuwa suspected cases, so we have to clean it and then tutumie baadaye kwa mwingine.
Both the ambulance operator as well as the paramedic doff their PPEs. According to Kagumo, This is the most critical point for a paramedic, as major infections by health workers are contracted during this process of doffing. Diana Rose, Switch TV.